Michelle, this is Ryan for a quick sound check.
Thank you, Ryan.
Michelle, it's Jody. I didn't do one either, but I can see you fine.
Thank you so much, Jody. Sorry about that.
Hello, this is Matthew Munch. Can I be heard?
Yes, you can. Welcome, Matthew. Thank you.
All right. I could hear all of you guys earlier, but it said I was muted by organizer, so now I'm on my phone.
Perfect. Sorry about that. Mr. Mayor, you ready to go?
Whenever you are.
We're ready, sir.
All right. Good evening, everyone. This is Herb Atchison, the mayor of the city of Westminster. I would like to welcome you to the special meeting of the city council for March the 26th, 2020. At this time, I will recite the Pledge of Allegiance, and those in the audience are welcome to join with us. I have everybody on mute, so unfortunately, I'll be the only one talking at this point. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this point, I will turn to the city clerk and ask her to please take the roll.
Thank you. Mayor Atchison.
Yes.
Councilor DeMott.
Here.
Mayor Pro Tem Seitz.
Here.
Councilor Seymour.
Here.
Councilor Scully.
Here.
Councilor Smith.
Present.
And Councilor Bowles.
Here. Okay, thank you, everyone. Tonight, our purpose of meeting tonight is not to conduct city business, but to provide information. And for the public listening in, we welcome all of you. We have assembled a number of questions that we're going to try to get through as soon as we can to provide information not only to the council, but to all the public listening in. We have on the line with us the city manager, a number of department heads, and our deputies as well. So put it on pause, listen in to us. We're going to try to get through these. We have a good list of questions. The questions were submitted by each of the council members and compiled by the city clerk. And the intent is to try to answer as many of these as we can in whatever time it takes. And there may be more questions that come up, and we'll try to deal with those at the same time tonight. One of the things that we're dealing with is the fact that we have an ever-changing situation with this COVID and the stay-at-home orders. To try to bring the public up, as late as Tuesday morning, Tri-County Health and Jefferson County Health both were issuing stay-at-home orders. The way the city is divided into two counties, we have orders coming from both groups. Both groups had also, as late as Wednesday morning, confirmed with the state that they were not planning to issue a stay-at-home order on a statewide basis, which we had all been requesting. Unfortunately, Wednesday afternoon, that all changed. So since Wednesday, the state order went into effect at 6 a.m. this morning. Throughout the day, the counties, including Boulder, Adams, Arapahoe, Denver, Douglas, Jefferson, Broomfield, and Boulder, have all rescinded their public orders. We have had one addition from Adams County that will be extending the county closures will continue until April the 20th, but that is not a stay-at-home or is strictly a closing of business. We are still trying to get definitions on a number of issues. We had a meeting with Tri-County as late as about an hour and a half ago with all the people who are affected under the Tri-County order, and we're trying to get definition of the differences between the state order and what was issued by both Jefferson and Tri-County. The details in the county orders were more specific than what is in the state order. So we are going back to the state. That meeting is occurring right now with Tri-County and the state trying to ask for clarification on a number of issues. Something as simple as, can we return to church services? Can we have a golf course or a tennis court open? What is meant by disposition? What is some of the essential services that were defined clearly in the county orders, but are left up to interpretation by the state order? So the state order is anticipated that even tonight or tomorrow, we will see additional changes to it. So this is going to be an ever-changing issue that we're going to have to deal with probably for several days. I had a meeting this afternoon with Senator Bennett, Senator Gardner, and Governor Polis. This has to do with the stimulus bill that is in Congress right now. The latest information that they had as of 4 o'clock this afternoon was that the individual checks that people are waiting for will probably not arrive until at least the 3rd week of April. Small business loans and grants that they are dealing with, Senator Bennett and Gardner both indicated that they thought that those would be processed within the next couple of days. There is severe funding that's going to come to the state. Unfortunately, we don't know how soon that's going to get here, because once they pass the bill, which they have not, and the president signs it, the institution of the bill still has to be worked out. So there are a lot of issues of how this is going to be dispersed, who's going to get what, where. Those issues still have to be worked out by the delegations, and they are all working to try to do that. And they understand the urgency of trying to get decisions made and get this out to the public as soon as possible. I can't tell you any more of the detail of the federal bill than that. They are continuing to set up conference calls with the mayors, county commissioners throughout the state as information becomes available. I do not expect to see another update on anything on the details of that bill more than likely before Monday or Tuesday. We are also having meetings across the metro area with the metro mayors. We had a call this morning asking for the state as well to go ahead and dig into some of the things they've issued to get more specific, because of the confusion that had already been started by so many multiple orders coming in from the metro area. My anticipation is that now that we have a state order, we will get some clarity of what's going on, especially for us here in Westminster dealing with 2 different orders. It's very concerning that we took so long to get that out. This is a decision that was made by the governor to finally come out that we've been asking for about 10 days. Therefore, the counties went ahead and said we could not wait any longer. We had to go on and get something for our citizens to know what to do. The spacing issues that are being questioned by people, the small business stuff, I will tell you, we're trying to answer as fast as we can. Last night, the City of Westminster held a webcast, which included economic development staff from all of our neighboring cities, as well as the state and the counties, on giving information to our small business groups on what they can do to help themselves and their employees who are being laid off. That link and that website will be updated so that you can go to that link. I have provided that to all of the council members as of this afternoon. We've had good input from that. It also has been distributed to all of the mayors in the metro area so that they can take the same information and pass that on to the residents they have, especially their small business groups. I wanted to thank all of our neighboring cities for participating in that event last night. I believe several of our council members were online listening to it, but I'd also like to single out Greg Moss for doing such a fantastic job of getting out that data, making it understandable, and pulling that all together. So Don, we appreciate very much that you had the staff working on that, and part of the stuff is getting information out to our small businesses. We have talked to our major employers, some of those that are in the business of employees of 500 or more. We've had several discussions this week, some as late as a couple of hours ago. The non-critical people are working from home, telecommuting. All the companies I have talked to in the last few days are at 90% or more of non-essential people that are working from home. And we greatly appreciate the work that they're doing to reduce the exposures we have. Unfortunately, we have had some businesses that, because of the restrictions, especially in our restaurant areas that do not have the capability for doing carryout, that have shuttered their doors. We are asking those that I have received notice from to please contact the SBA to see what might be done to help take care of those workers and see that they still get checks. Unfortunately, the state is like many others. The website for the Small Business Administration as well as state unemployment is just swamped with calls. I know people are having several hours if they can get in at all. So I ask you for your patience, to keep trying through that. Even if you're only working part-time, now because your service hours were reduced, you still have the ability to file for unemployment to offset some of that loss. So if you are listening in, you're an employee or you're a resident and you lost part of your income, I would highly recommend you go ahead and get it into the system as soon as you can to get filing. We are seeing tens of thousands and hundreds of thousands across the United States and not millions that are filing for unemployment. So we are asking you to please be patient with those websites. We're trying not to crash them, but we also want you to get in as soon as possible. The purpose of tonight is to try to go through these questions that I explained earlier, and we're going to try to start with the way that they were received. Councilor Scully, I'll start with your questions. On the first question you have, I'll try to answer that one for you since I've been talking with Denver as late as a couple of hours ago. Denver has rescinded their order, as I indicated earlier. They're under the state order. They are not in a lockdown in the sense that they can't move around to some levels, but they're going to follow the state mandate. I did talk to the Denver representative a couple of hours ago because we have experienced some information fed back by even some of our employees who were passing through Denver that they were being pulled over by Denver police and questioned about where they were going and why. In this case, we have done our best to identify our critical employees, but I am being told by Denver that they are not actively doing this, but they're going to go back and check and see what they can do. So I will try, for the purpose of the question, I'll try to read the entire question. First question that Councilor Scully submitted is, I have heard a lot about the City of Denver's lockdown guidelines and fines. What can and can't residents do under lockdown? And if lockdown is violated, how will that be addressed? And will there be fines for violation? All of us have asked for compliance on a voluntary basis. But if people call in and raise an issue that people are not in compliance and they're gathering in groups, we will respond from the city, as all the other cities have indicated they will, and ask for voluntary compliance. Unless there is an issue from the police that are there or the code enforcement, whoever that person is, that escalates because of a non-compliance issue, then that is going to be up to that individual officer or law enforcement person to make a decision of whether or not they are going to issue a citation. Under the state order, there are fines and consequences of failing to comply with an order from an authorized person in regards to this. And depending upon where you look at the order, that could be jail time or it could be a fine. It will depend upon how the court ends up dealing with it at a later date. Don, I'm going to return to, I will read question number 2 that Councilor Scully has, and then I will turn it to you to answer. There seems to be concerns from residents and the business community that we are not utilizing our partners enough. How are we partnering with community businesses, such as Westminster Chamber of Commerce and regional partners, county commissioners, and school districts?
Thank you, Mr. Mayor and members of the council. I'm happy to take a shot at this, and I'm going to ask a couple of people to add to what I have to say here. This issue, COVID-19 and the spread of the virus in our community, has been something that we've been working on in the organization for a few weeks. We have an emergency operations center that's been stood up. It's being led by Max Kirschbaum. When I get done, I'm going to also ask Max if he would make some comments about what that means and how that's helpful to our residents. But specific to the question of partnerships and communication, Westminster is a leader in the region in our relationships with school districts, with the business community, business organizations, and with other regional governments, including the county. But I will acknowledge at this time, we have focused the last couple of weeks on our city and getting ourselves ready to make sure that our police and fire, EMS, paramedic, our water utility, and all of those essential services are organized and stood up, and our workforce has been clearly communicated with as to how we're going to handle their work scheduling and the like, in light of the fact that we want to keep them healthy. So we've really focused our time, attention, and energy. I would say regionally, in addition to that, I've been involved with a lot of support from our economic development, our finance staff, human resources, and our attorney's office and others in engaging and pushing our way into conversations on this stay in place order. The council provided direction, and we certainly support that, we really have dual missions here. We have a mission to keep our community safe, to try to stay on top of this virus as best as we can, and to follow World Health Organization, CDC, Colorado Department of Public Health, and our own local health organizations and their advice on things such as social distancing. So when a few days ago this issue of social distancing came up, with the mayor's help, I was able to engage with a number of other city managers and have some input and influence over how those orders were written. They're not exactly the way an individual city such as ours might have done that, but I think now we have agreement on the necessity, number one, and the ability to execute and put this into place. In terms of enforcement, Mayor, you covered that a little bit earlier. If you'd like, the police chief is on our call here today too, and is able to address that. So, Commissioner Scully, are you clear in terms of an answer on that? Is there more that you'd like on question number 2?
No, sir, I think you answered that very well. Thank you very much.
So if I could, I'd like to turn to John Hall, because he has some very specific information about what we've been doing, moving out of the mode of making sure we're organized to get through the COVID and the virus that may hit our own workforce. And when we start thinking about a recovery phase and a future that's economically sustainable in our city, John Hall, our Economic Development Director, Larry Dorr, Finance Officer, Deputy City Manager, have been working in that space very effectively. So John, would you go ahead?
Thank you, Don. Mayor and Council, this is John Hall, Economic Development Director. I'll start by amplifying the answer to Councilor Scully's question. To give you an example, today I had 2 meetings with the Chamber of Commerce. The city had 2 meetings with the Chamber of Commerce, Westminster Chamber, and we have agreed on a specific set of actions that we'll be taking together. I also had a meeting with the Adams County Business Response team that is putting together an action list of items for us to tackle. I have been working directly with the state Office of Economic Development and have been involved in phone conversations with the governor's emergency council on economic growth and recovery. So what I would say is we're partnering in every way we can, depending on the issue, depending on the geography. Hopefully most of you got to see the business forum last night. So there is a great consensus among the communities that we need to work together to move forward. So for the city of Westminster, we will be working on business outreach in our initial phase. We are already doing so. That will be contacting businesses both through web presence and proactively through phone calls. We will also be forming working groups that include private and public representatives to develop a strategy moving forward. Obviously, the big question that still hangs out there is the financial one, and how small businesses survive what is, at this point, an undefined period of closure. And our strategy relating to what that might look like will somewhat depend on how long those businesses have to remain closed. That is, a 30-day strategy looks quite different than a 60 or 90-day strategy. You have seen some other communities put together financial assistance packages for businesses. We are evaluating all of the options before us, and we'll be coming back to you with specific recommendations. Of course, any dollar we spend anywhere has to be balanced against other priorities in the city. So I'm happy to provide more information, but I think I'll stop there.
John, before you go away, I've got a couple of people who have questions, so I'll try to do those. Councilor DeMott, I got you first, then Councilor Sykes.
I had two questions, and they're separate areas that you guys covered a lot of things in that first question. So the two things that I'm curious about, and I'll go ahead and say both of them, and then the city manager can get the appropriate answer. But you talked a little bit about Denver, but I'm curious about how our police chief plans to enforce this. The other thing that I'm curious for you to share with us and the public is around the team that stood up to deal with this situation. You talked about Max Kirschbaum being in charge of that team, and I know we have a director of emergency management, so I'm just curious if you could share kind of what that looks like and how that decision was come to, so that both the council and the public who is listening could understand. And those are the two things that I would like to ask about in follow-up to what was shared so far.
Thank you, Councilor DeMott.
Okay.
Those are good questions. I can take those, Mayor. I want to start by bringing Max Kirschbaum forward here, and I'll just comment. Greg Mosier, who's our Director of Emergency Management Services, is very highly and effectively involved in this process. But it is a cross-functional process from throughout the organization, and we've asked Max to step forward without going into a lot of his background. Max has an extensive background that provides a very highly qualified opportunity for him to lead at this level, and so that was why the decision made. But Greg has a very, very important role, which Max will explain. And then after that, I think we'll have Chief Carlson address the question of enforcement and how he looks at this from a policing perspective. So Max, would you go ahead, please?
Sure. This is Max Kirschbaum. I'm the Utilities Director for the city. If I could just back up just a little bit to explain how we got to the point of the city's Emergency Operations Center. In early March, a working group for COVID-19 was stood up under the guidance of the Emergency Management Coordinator, Greg Mosier. The initial focus was on mitigate the impact of COVID-19 on our employees, on city operations, and on our community. When the emergency order was declared for the city on or about March 12th, at that point, the Emergency Operations was stood up. The purpose of the Emergency Operations Center to provide a nationally recognized framework for city departments and our community to support the efforts of, in this case, of the public health agencies, and to mitigate and respond to the non-medical consequences of COVID-19. The focus is on health and continuation of essential services provided by the city. Thereafter, published an annex specifically for COVID-19 to the city's emergency operations plan. That was published earlier this week to serve again as a guiding document for the Emergency Operations Center. In that document, we identify external incident command. In this case, that external incident command are the two public health entities, Tri-County Public for Adams County side of the city, and the Jefferson County Public Health on Jefferson County side of the city. Internally, serving in a lead role for the EOC. Part of that role is also to be able to the city manager's office. As was asked in that question, Greg Mosier, the Emergency Management Coordinator, serves as the EOC manager, and he will ensure that all city actions are consistent with federal, state, and county orders, facilitate coordination with various government, business, nonprofit, and volunteer agencies to help deal with any of the taskings that we take on or as a city receive from the counties. And this week we began publishing, as of yesterday, a daily situation report, which will be provided to the city manager's office as progress of each day's events, as well as to the city council. And that will be provided typically by the end of each day. I'll stop there if that is satisfactory.
Thank you for the answer. I appreciate it.
Chief Carlson, can you respond to the second question?
Yes, sir, I can, Mr. Mayor. Thank you, Councilor Demont, for the question. And good evening to all our council members and staff and our community members. My name is Tim Carlson. I'm the Chief of Police for the City of Westminster. And I don't have a lot to add to what the mayor described earlier as far as our response in the police department to the state order. Our emphasis and philosophy is on education, communication, emphasis on public health. That is the direction that I've been given, or I've given to our officers in responding to some of these potential violations of that order. It's a difficult and awkward time for everybody. There is certainly provisions, penalty provisions written into the state statutes reference this statewide order. We certainly won't ignore those issues that happen. That is certainly an option, but really the emphasis will be on trying to get our community well educated and understand the necessity to follow the order. I will tell you that that philosophy is consistent throughout both Jefferson and Adams counties and the law enforcement communities, and quite frankly, probably statewide. It is also consistent with the governor's recent guidelines issued for law enforcement related to the COVID-19 event. So we feel like we're responding in the same way that many of our fellow community members or communities are, and we feel confident that we can show high visibility in the community, maintain public order, address some of these potential violations in a way that is healthy, appropriate, provides education, and provides for public health.
Thank you, Chief Carlson.
Mr. DeMont, does that?
It does. The last thing that I would ask, and this is more for the city manager, I know that we've had a lot of talk around education, and I think that's really important that, you know, our goal is not to limit the freedom of the residents of Westminster or the state of Colorado for that matter, but more to keep them safe. So, Mr. Tripp, could you talk a little bit more about how the city is using its presence between social media and website and stuff to educate the public so they understand, so the police department doesn't get into the position of being the ones to educate?
Well, we have a team that's working around the clock on multimedia between the website, our digital platforms, and print media. And, you know, we're pushing out, I think, a common theme, which is public health and safety and economic resiliency and understanding how both can happen. So I think we've been consistent with that message that we're behind the public health orders. We think those are necessary, and we completely are in concurrence with that. And then we're trying to explain in the moment these orders that come down. As an example, I got an email at 5:05 yesterday that explained what the county orders were going to be in health. I had until 6 to react to that and provide input. At 6 o'clock, they made that announcement. And I think it was later in the day, or maybe first thing this morning, I guess later in the day, the state turned on that and went into a direction that was very similar. And I tell you, when I woke up this morning and turned my computer on, our communications people had already updated our website, and we're talking about the state order and the changes that have been made. So we're trying to be in the moment, but as with my communication with you, I appreciate the fact that you're allowing me to bring communication to you every day, and then if we've got something urgent in the moment, because it changes so rapidly, and the misinformation that can get out there is what bothers me. So I think maybe the foundational answer to your question is we're being swift, but we're making absolutely sure that we're as accurate as we possibly can be.
Thank you.
Ms. Seitz, you had a question.
Thank you, Mr. Mayor. I have one of my first questions. I think Max Kirschbaum did an excellent job answering. My question was, how were we collaborating with public health departments to help inform those internal policy and procedures, because we don't have a depth of public health expertise, as that's outside of the role of municipal government. So I am happy to hear that Mr. Mosier is helping to interface with them and then fold that into what we're doing. My second question is, how are we reaching out to organizations that represent some of our vulnerable communities and collaborating with them? So obviously small business and even large scale business are going to be impacted by all of the orders and just the situation with COVID in general. But people in our community, workers, are also hurting. And some of our most marginalized community members are going to feel that most acutely. And so I was wondering, who have we reached out to that interfaces with those groups? What measures have they recommended for us to kind of either suggest or to implement in order to assist those different populations?
So, Mr. Mayor, I'm happy to take a shot at that, and I'm going to cue up Barbara Opie to follow me here. I would say, first of all, I would say thank you to the City Council and past councils for programmatic staffing and resources to have people in place to deal with various populations that are threatened and are, as you've stated it, very vulnerable in this case. We have that in our Parks, Recreation, Libraries Department housed there because many of these issues happen in public spaces, and the interaction is in public spaces. Deputy Barbara Opie is over Parks, Recreation, Libraries and their department. And Barbara, if you wouldn't mind talking about what we're actually doing within the park system and how we do that on a regular basis, the education we're providing, but moreover, we've been called into various other regional organizations, and we're participating in those as well.
Thank you, Don. As far as the different things that are happening, obviously with the homeless components and other food bank components, we've been working with Tri-County Health Department, several churches, and some nonprofits, Growing Home, Have a Heart, Food for Hope, and some others with the Salvation Army to ensure that the community has enough access during this time. We're working with the Food Bank of the Rockies. We don't waste in grocery stores and other groups as well. And so they're coordinating efforts there and trying to work to help support those entities as they're moving forward. We are working to find ways to help support those components of how the food pantries are currently ensuring that they have enough food, supplies, and staff and storage to meet the demand. And we're working with those groups to do so.
Thank you very much. I appreciate your efforts. And I presume this also includes reaching out to mental health care providers. In addition, like community reach, have we been in touch with them? A different population, obviously, but still another vulnerable and I think disproportionately impacted population.
I apologize. I don't have that information. I can find that out and I'll get back with you.
Okay, wonderful. And then my last portion of this, another group that I was wondering we should collaborate with is groups like UNE. I know they've recently reached out and I've shared that out, but things that support workers and renters, helping them stabilize right now at this time of economic hardship.
Very good. Very good. This might be this might be a good place to interject. Our communications folks and my assistant quickly put together an email site that the public can use to input directly to us and follow-up questions they have, and any of the organizations such as the ones you mentioned that have ideas or need assistance or want to know how we can interface with them. Cody, would you mind sharing, if you're on the line here, would you mind sharing what that email site is?
Sorry, trying to unmute myself. It's a web email address, and it's posted on both our COVID webpage and then also the City Council meeting webpage. It's COVID-19@cityofwestminster.us. All one word, City of Westminster. And COVID, there's no dash. It's COVID-19.
So Thanks,
Cody.
That's a location that you can email into and can expect a quick response. We're looking at that on a regular routine basis, and that's both for advice, questions, anything related to this that's not covered in our website. I'd also mention that our website is very extensive and has a number of different drop downs that has great information, as all of the cities around us do. Also, we're sharing those kinds of information with each other, and it's worked out really well so far.
One other thing that I would add is that on Monday, I've been asked by the Westminster Chamber to do a webcast with them to talk to the small businesses. So that has been set up. I don't know what time it is yet. Juliet Abdel, the executive director for the chamber, is getting that set up. It'll be sometime Monday. If that's okay, Ms. Scully, we'll move on to your question 3.
Yes, sir. I would like you to move on to my question 3. Thank you.
I'm sorry. Okay, I think I got it. All right, so her third question was, we have gone to great measures to ensure the most vulnerable of our community have access to toilets and places to wash their hands by putting porta potties in parks throughout the city. Will those remain in place, and are they or will they be sanitized to stop the spread of COVID-19? Do we have ways to ensure our local food pantries are stocked and accessible? Mr. Tripp?
Barbara Opie, please.
Yes, sir. As far as the portable bathrooms, the restrooms have actually been delivered to our park locations. They were delivered the weekend of March 14th to our designated park sites that typically require portables each year. The contractor is responsible and does clean and service those portable restrooms twice a week through the end of October. We have confirmed with the contractor that the portable restrooms are being sanitized at each cleaning in consideration of COVID-19. As far as the food pantries, again, that goes back to my previous information as far as the different efforts we're working with the food pantries to help identify where there's opportunities. Our understanding is that food pantries currently do not have enough food supplies or storage and staff, and so we're working with them to try to help meet that need. So if folks are willing to and can donate, we would encourage them to do so.
Adding on to what Barbara was just saying, one of the things that we are being asked for pretty well across the board is those who are not sick, have no other restrictions. There is a huge demand for blood donations. And there are opportunities right here in the city where you can go to donate. So if there's anyone that's on the line or listening is willing to donate blood, call your local Bonfils Center. I know that Bonfils is the old name, but we'll make sure they're... Go ahead, I'm sorry.
Oh, sorry, I didn't mean to interrupt you. It's Vitalent now. You're correct. It's no longer Bonfils.
Yeah, thank you, Ms. Smith. So Vitalink is a place to go, but there is a huge demand for safe donations today. We're asked several times if we can bring that up. We've been trying to put that information out. So if you have the opportunity and are willing to, please sign up for a donation. Ms. Scully, has that answered your third question?
It has. Thank you so much.
All right, I'm going to move on to Councilor Seymour. Mr. Franklin, I think I'm going to turn this one to you. This is a brief review of authority granted to health departments to issue order and the enforceability of said orders.
Yes, Mr. Mayor. I understood, though, that it's possible Mr. Seymour, Councilor Seymour, was withdrawing his first question. Was that indicated in the chat?
Yeah, Mr. Mayor, I'm withdrawing it. It seems to be a moot question at this point now that the governor's orders have overlaid those and the county health departments are withdrawing theirs.
Thank you, Mr. Seymour. I know the thing is that with multiple organizations having an effect in Westminster, having multiple orders has been a scare point for us. Well,
it's definitely been challenging,
moving on
Mr. Mayor. This is David Frankel speaking, City Attorney. I just wanted to mention that this has in some ways become much simpler over the past 24 hours. Obviously, at the beginning of the week, when Denver enacted its stay-at-home order, and on Tuesday, leading to the two counties to each consider through their health departments stay-at-home orders, leading to the possibility of having 3 different standards that we would have to deal with within our city. I think the governor's decision to enact the public health order implementing stay-at-home requirements has simplified the task for all of us. And I think that one of the resources I would direct people to would be the state of Colorado's website, which has an FAQ, which explains the public health order. The document itself, the order is some 12 pages long, so it's not simple, but the FAQ is available through the state of Colorado's website, and it's quite helpful answering commonly asked questions.
Mr. Seymour, are you okay with the answer?
Absolutely. Thank you, Mr. Frankel.
All right. Moving on to Mr. Seymour's second question, discussion of timeline and communication to council during negotiation and how to bridge gap immediately with new technology and accountability. Mr. Tripp, I'm going to turn to you and I trying to respond to this. The city manager and myself are in multiple meetings a day on discussions of what might or might not happen. In most cases, we're erring on the side of caution to not put out stuff that is changing by the hour. Typically, a good example would be the health orders that were issued by Jefferson County and Tri-State. Although a lot of conversations were being had about the order, the final decision on what was going to be in the order lied with the county health department or Tri-County. And until we got the order itself, we never did know what was going to actually be in the order. So if we had been putting out stuff, it was gone as it was going on, we would have been putting out a lot of bad information. Mr. Tripp, you want to add to any of that?
Rich, I'm going to assume when you say negotiations, you are talking about those health orders. Is that what you were talking about?
Yeah, that initially it was Don and Mr. Mayor, in understanding completely how the situation has been very fluid for over a month now and will continue to be some time. My initial thought was, and that's why I originally called for this meeting and was very excited that all the members of council, including the mayor, seconded that motion. And I thought that, during a time of crisis, our residents expect us to work for the good of our community and to rise above and deliver strong, unified message. And so I felt, as it must have been some of my other counselors, disconnected. And so I think that a big part of the reason I called this meeting was to help us formulate good ideas, because when we work better together, we're going to be better for our community. And we can help them with the questions, that the concerns that they have about their families and how they can help them and their neighbors. And, I just was hoping too that as part of this, we do better when we converse with each other. Face to face is always better, but that's not part of the current world. But I just wanted to talk about council, each one of us individually committing to each other, to communicate as much as we can and as timely as we can, keeping in mind, open records, but information being pushed out is very important. Especially in light of what we're hearing from our residents. And then that way we can all work together to be conduits and let our outstanding city staff and communication get that information out on a regular and ongoing basis to our citizens. So I appreciate that opportunity, and I very much appreciate this opportunity tonight for all of us to be present and show a united front for our entire community.
Thank you, Rich. I'll move on to your third question, if that's okay.
Absolutely.
Third question are what resources are needed by our public safety staff and potential outcomes? Mr. Tripp?
Deputy Jody Andrews, would you want to take an initial shot at that? And if there's follow-up that the chief's needed for, but Jody, I'd like to get you in front of this.
Thank you. Just to clarify, this is question 3 regarding public safety staff, is that correct?
Don, should I answer this question for you?
Yeah, I think maybe I would actually ask my colleague, Deputy Opie, to maybe lead this answer.
That was a kind way of saying, boss, changed a month ago. Yeah.
No worries. Thank you very much.
Thank you.
At this time, our public safety staff, we are having regular touch bases with both police chief and fire chief. They are informing us that there are issues that are coming up. They are working through the EOC on their needs. I know that both have enacted measures to ensure that they have the PPE that they need, the personal protective equipment that they need and their staff needs to ensure that they're able to operate. We're also working with them on policies and regulations that are needed or need to be modified in order to allow them to be fluid in addressing their immediate needs as far as resources, but also as far as how they deploy their staff. With that, I'm happy to defer to Chief Carlson or Chief Hall to provide additional information.
I'd be happy to chime in. Tim Carlson, Chief of Police. I appreciate the question. From the PD standpoint, we feel very fortunate to have the resources we need as we launch into this crazy issue. We've worked very hard in the past week to attain some of the personal protective equipment that Deputy City Manager Opie referred to. There's an ongoing nationwide shortage of N95 masks. We have enough for us at the PD now. That will be an ongoing issue. That is probably the one piece of equipment, if we really drill down into the weeds, that we're constantly looking to ensure that our staff have. I will assure you that we do have adequate supplies to do what we need now and in the near future. So feel good about that. Our resource management with our people and our personnel is in place. We have a detailed plan for how to respond to this over the long haul with resourcing of our people, as was just mentioned, and how we would do that going forward if we have folks that can no longer work for a short period of time. I feel real good about where we're at in the police department.
Chief Hall, do you have anything?
I do, sir, and thank you. Good evening, everyone. I can report that in concert with our police department, right now, we're setting pretty good with regard to our PPE. It will become an ongoing issue as this situation scenario continues. Two other issues that we're focused on and continually talking with our healthcare officials about in our hospital facilities is the need for testing and getting testing done. And as importantly, or probably more importantly, for the safety of our people, getting some test results. It just seems to vary from day to day how quickly some of that results can come back to us. I will say there's been a lot of discussion across the media and different arenas about this national stockpile. We have been advised in the Denver area not to hold out much hope for that. It's being directed to areas that are perceived to have a much higher need. But we are fortunate in the city of Westminster that within our EOC, the leads on our logistics section are directly connected as logistics officers for the Urban Search and Rescue Team, which is stationed here in Colorado, Colorado Task Force 1. So one of the things that we are looking at as a positive is having that direct connection so that when things do start to churn in terms of PPE availability, we'll have people that are able to recognize what's going on within the system. They can access the system, and hopefully it'll benefit us. And that's all I have right now, Mayor.
Mr. Tripp, you want to add anything to that?
No, sir. I think those are two directors that do a great job. And, I would just say that organizationally, we've been careful. I've been careful through my office to back up and let the department directors run their departments. We don't have a lot of overarching policy directives except to keep the public safe, healthy, and keep our staff safe and healthy, to continue operations. And they know their operations really well. Assure you, council and public, if they come into our office and need something, we are going to try to find a way to get it for them.
Just to mention one quick thing, on the city website, on the cityofwestminster.us//COVID-19, there's a lot of information about frequently asked questions. If you go into the second paragraph, that might help you a lot on looking at that. Mr. DeMont, you had a question.
I actually just have a point that I'd like to clarify, and I don't know if City Manager Tripp or you could speak to it. But this is back to question 2 of Councilor Seymour's, and I think Councilor Seymour articulated well some of the concerns that brought us to meet tonight, that originally he asked to meet and I seconded that. And in our initial discussions, one of the things that I want to know as we move through this process is, are we learning things? And specifically, like Councilor Seymour mentioned, getting more information more quickly through technology. And I know I appreciate you laying out the timeline of how things have went for you guys. I think that part of the frustration for us, and maybe it couldn't have been avoided, but it's at least worth mentioning, or at least me specifically, is I saw some of this in a paper article before, probably an hour before I got an official notice about it. And I think some of that's just the way that it's come down. But point being is, have we learned anything that we can try to, continue to update council as we go through this? Because one of the things that was pretty in-depth discussed when we kind of went through and codified the whole emergency powers that were given in the situation that we're in was that constant flow of communication. And I do appreciate the daily updates, and we do get a lot of great information. But with things like that, when we're going to a situation in the state and country where we're limiting the freedoms of citizens, I just want to know, what we have learned so that we could try to make sure that council is better aware, so that we're hearing things from you guys opposed to reading it in the Westminster window.
Thanks for the feedback, Councilor. Yeah, thanks for the feedback, Councilor DeMont. Without going too far into the weeds of the detail here, I do hear you, and of course, we're always trying to get better in the area of communication. We have some things set up that on a regular basis, and I'm really just thinking about how this looks moving forward. I think it's very much situational. What we learned in this situation was something that I didn't realize, was that the departments of health on both county sides were able to trump in on our home rule authority in the area of some of these regulations that were created. We were discovering that earlier in midweek. And I'd say in that regard, I made a judgment call in terms of my own personal time to do what I could to try to coalesce and spend as much time as I could with my colleagues in the other cities, believing that I wasn't going to be able to move the needle on behalf of Westminster without the support of other cities. I think that ended up being effective. But the thing is, ironically, at the very end of it, and it's interesting that you mentioned the newspaper article, because I read that article too, and that article was printed before I was provided a copy of the order, which I think it isn't intended in any way to criticize anybody except to say it was a quickly moving a piece of information. Having said that, my job is to have all 7 of you content that you have a chance to do your job and represent the people who elected you. And we'll continue to work really, really hard to do that in a more effective way. I've got people who are listening in on this that, help with great strategy and ideas. And it may be that we need to meet more often. This meeting tonight, I think, is a great effort in that regard. I appreciate those of you that called for it. I think it's timely. I probably wouldn't have chosen to put a meeting in the calendar right now with everything that's going on, but I certainly see it as being helpful. And I hope we have a lot of people listening in because there's great information being shared tonight that I think the more people know about what's happening, the safer they're going to feel in our city, because I'm really, really proud of the work that's being done. And I don't want to minimize how difficult and bad of a situation this is. It is all of that. But you're in a city that is really properly resourced and certainly has a lot of expertise to work us through. But having said that, Dave, we'll always try to do better.
No, I super appreciate that. And I super appreciate you sharing the fact of how you read that article. That is very helpful to me. I think that this dialogue is really important, and I do understand there's so much going on, but I think that us being the conduit to the residents, us continuing to show that we're in lockstep is very, very important to me. And I think it's very, very important to the community, so that they're comfortable, that I know as much as I can, and that, we're showing that united front, kind of like Councilor Seymour had mentioned, and frankly, that we spoke about the last time we met in person. So I appreciate all that clarification on it. And I just wanted also to be fair to, what kind of brought us here and why we thought it was, at least me specifically, I thought it was important that we needed to have this meeting sooner rather than later, understanding there is so many important things going on. And I will give a lot of kudos to you and your team as far as how you guys have been handling it. And I appreciate the ongoing work by all our employees, specifically the ones that are out there risking themselves to keep the community safe and things orderly.
I need to be more careful how I choose my words. If I said I read that article, that was not accurate. I didn't have time to be reading any articles, but somebody did text me in the middle of it and say, do you understand that everything we're working on right now is already in the newspaper? That's how I heard about it. So,
fair enough. Thank you for the clarification.
Yep.
All right, I want to move on to Councilor Seymour has said that we could withdraw question number 4 because it has already been answered by Mr. Hall, but I would answer one other part of that is with the webcast that we're planning on Monday with the Westminster Chamber, but also the product of the webcast that was done last night with Greg Moss and the rest of the team. We are still waiting on a lot of the detail coming out of the order that is legislatively being done right now at Congress, to see what information we're going to have. The details are not there at this point. We don't know how soon they'll get them, but on the call I had with the governor and the senators this afternoon, I'm expecting we're not going to see anything at the high level until the first part of next week. And then they still have to propagate that down to the states. We did ask that group this afternoon to please consider, and I have also spoken to Congressman Perlmutter separately on this, to ask if they would consider the disbursement of funds to come through our community development block grant process, because that would get the funds to us to send out much quicker than if we have to wait for it to come to the state and then be repropagated back out to CDBG. So we're hoping that they're going to listen to that, but they have not made any commitment of the recovery funds. And again, right now, the individual checks that are going to go to people who have a tax ID number, we're still looking at least at the 3rd week of April, but SBA is working through that, and I would encourage everyone to go to the site that we used for the presentation last night. It gives you all the links necessary to get you into the ability to find out more direct contacts with SBA. Moving on then to Councilor Seitz, I thought I've gotten a couple notices from you. I think the second question, you said you were okay with dropping.
Correct. It's already been answered multiple times. So,
Okay, and going to question 3, you had a part of that.
yeah, but let's answer question 1, only the last portion.
Yeah, I'm coming back to it. I just
needs
want to
be-
make sure which ones I can skip. So
Yeah,
I'll go back
question 2,
to
please,
question
Brett.
1. Okay. I'll go back to her first questions. I thought the meeting might be a good opportunity for staff to give us an update on all of their efforts regarding COVID-19 to date. Specifically, I would like to have stated and discussed for the public record the projected impacts of COVID-19 on public health that led the health departments issuing the stay-at-home order, including, if available, the number of critical care beds in our region, the number of ventilators, and the status of PPE at our hospitals. I would like to understand the forecasted economic impacts of our community. I think also explaining the role and authority of the health department would be helpful for the general public and the council.
That last portion, Mr. Mayor, I would strike because I believe our city attorney has already answered. It's irrelevant now, and
I'm going to answer a piece of it only because we've been having some calls. I talked to one of the hospital CEOs about 3 hours ago now. The issue that the chief described, Chief Carlson, with the hospitals is no different. PPEs and ventilators are still a major issue with all of them. The governor this afternoon talked about that they are trying to get them in a private process, not waiting on the federal government. He did not indicate how many he was able to line up or how many he would have available. I have not heard from any of the 4 hospital CEOs that we have here that serve Westminster that they have a critical shortage of PPEs at their hospitals, but they are monitoring the situation on a daily basis. Other than that, Mr. Tripp, I'm going to ask you to try to answer the first part of it.
I'm going to ask Chief Hall to come up. You know, in his role as fire chief, really public health is his interface. Of course, we all support that on a policy level. You folks that are elected and in the staff, a number of other people in terms of safety. But I'm going to ask Doug if you wouldn't address this. I would tell you that we've all learned an awful lot about our public health systems, and you know, and it's remarkable to me. I have to say, in a time of unexpected emergency, I'm humbled by our public health organizations and the job that they've done on the fly and even changing within hours. They've helped get us into the right position. If you look nationally, I think we have a real strong mandate here to get separated and to have social distancing, which is going to give us a chance maybe to beat this virus down. But, you know, Doug, just from your perspective and an unbelievable career in emergency services and public health, can you provide some perspective for all of us as to what we're seeing here and your views on whether or not we have everything and whether we're thinking in the correct way from a policy standpoint moving forward?
Yes, sir, Don. Thank you. I think it's a pretty broad question, and I think it ties into 2 or 3 different, I guess, perspectives, maybe disciplines, and one is obviously the healthcare industry as it relates to the projected impacts on public health, and then there's also the issue that I alluded to earlier about the testing and the test results. And many of the state and national experts are telling us that it is trending, I guess the right word would be a negative. You know, we're not seeing positive trends. They're expecting and anticipating things to not get better in the short term. That's the feedback we're getting directly from the healthcare people that we're interfacing with as we focus on the emergency response side. To give you a very local perspective, again, once we get really good at the state level with the testing and we're getting definitive data back from those results, then we'll be able to understand a little bit more the bigger picture and a little bit more clarity. But I did have, and we have been tracking the responses that we have, and to share with you some numbers, looking at the time frame of March 13th through the 24th. We have identified 34 patients that we have responded on that meet all of the criteria for COVID patients in accordance with our medical direction. So that's done throughout the Denver metro area in terms of the medical protocols. So different organizations at the different levels of government may have different criteria, but we're following our medical direction. So again, that's 34 patients, which really averages out to about 2.8 patients per day. But we know, and I certainly support that, we know this, there are probably more patients in our community that are ill with COVID-19, but a lot of them are following their doctor's directives, and they're self-isolating and self-quarantining in their homes and working through this. So I will pause now and open it up if there's any additional clarification or questions.
So this is Mayor Pro Tem Seitz again. I think maybe it would have helped. I did not realize our questions would be read off. I thought it would be more of an open format discussion. And so the goal of my question really was to understand why a shelter in place, and not just for me, but for that kind of education component we were talking about for the public, because I don't want to scare people, obviously. I don't think any of us benefit by panicking or feeling like victims. But I definitely thought there's a healthy respect we should have for how contagious this is, and how shelter in place or stay at home or whatever you call it, how it helps us really take that power back and be able to effectively combat it. And if perhaps, again, as I stated earlier, I recognize that we don't have other than yourself, Chief, and a handful of folks that are experts on epidemiology or public health. So perhaps this is a hard question to answer, but I was wondering if anyone could go through just really quickly why this is the recommended course.
Well, that's the foundational question with all the directives and the orders and that type of thing. And you identified the specific issue, Mayor Pro Tem, when you talked about the opportunity for the virus to be transmitted so much between people. And there's no definitive cure for that right now. There's no, that I'm aware of, or at least it hasn't been announced through today, that they've developed a medical treatment for this, other than just sort of waiting it out and treating some of the typical symptoms with this, the shortness of breath with oxygen and your standard pain medications and that type of thing. But it is particularly dangerous for populations that are vulnerable. Certainly the senior population, and particularly those in the any age group that have underlying medical conditions. It can transition very quickly with certain medical conditions into pneumonia, and then there's just other various conditions that they've identified with diabetes and other types of pre-existing medical conditions that seem to compound the severity of the disease. And without any true medical intervention right now, then we have to segregate. We have to practice the whole concept of isolating and separating people. So is that on target for what you're looking for?
It is. And I would just, I guess I'm going to ask one specific question. Shelter in place assists us in preventing a surge at our hospitals that would overwhelm them. Is that correct?
Oh, absolutely. I mean, it's all about the different strategies and that type of thing. And I know that the Colorado Hospital Association is working diligently to look at where availability of beds will be. They're looking at how to manage the different types of patients and the criticality levels of those different patients to be able to manage for that particular surge. And I, in my conversations with the people that I think are the authorities locally here, that professional healthcare people, the scientists, the epidemiologists, what they're telling me and what I'm hearing is we will get some type of surge. To the extent of the surge is all going to be driven by the number of people that are ill that we haven't identified yet, because there's not a way to do that comprehensive testing. But then also related to the safe practices of preventing this community spread.
Thank you so
Mayor Pro
much,
Tem
Chief.
Sites.
I appreciate your answer. Yes.
Mayor Pro Tem Sites, this is Barbara Opie. The other thing I'd also suggest is that CDPHE, which is the Colorado Department of Public Health and Environment, has really great information on their website. They actually have case data that shows interactive every day. They update it around 4 o'clock that shows the cases of COVID in the state of Colorado starting back in February and where we are to date. And so it has some really good information about how it's escalating in our community, in our state as well.
Thank you so much, Deputy Opie. The last part of my question there was talking about forecasting economic output or economic impact. And I don't need that answered right now. I guess what I was specifically asking is if council can get updates on that more frequently. I am concerned as a community that is so dependent on sales tax revenue. I'd like us to be informed so it helps us with our policy thinking, how this will impact our general fund as it evolves.
Thanks, Councilor Seitz, for the question. In fact, I would like to answer it, and I want to answer.
Oh, okay, thank you.
I'd like to have Chief Financial Officer, Deputy City Manager Larry Dorr come up. You know, Larry was added to the organization just a few months ago, and how fortuitous we really need him and experience in this area at this time. And Larry's going to, Larry and I've talked about this, and he's going to answer in the context of process, because he's been thinking about this and looking into it here for several weeks. And Larry, share whatever you want to share at this point. But I would say that most importantly, the message is that we've got he and a team working on this from both a revenue and expense standpoint and the impacts of this. We're not going to be perfect or exact when we come out of the chute, but we're going to have a pretty good idea of the situation this puts us in this fiscal year, in the next 2 years, and in the next 5 years. He's looking at it that way. But Larry, would you go ahead? And I really wanted to say something, Mayor Pro Tem, because I want the you and I want the community reassured that we are thinking very seriously about this, and this is a big part of what we're doing. And I want you to be reassured that when it comes back to policy and the decisions that we make, we're going to have really good information for you, and you're going to be able to make tough decisions with good information.
Thank you.
Thank you, Mr. Tripp. Once again, Larry Dorr, Chief Financial Officer and Deputy City Manager speaking. And Mayor Pro Tem Seitz, I want to address this question that you have about economic impacts, but also, Mayor, you'll see that down the list of questions that Councilor Bowles also has a few questions about finance and economics. And I just thought I would address sort of everything all together and address questions sort of all at once for efficiency and effectiveness. Well, let me just say that obviously these are unprecedented times that I don't think any of us have seen. The information is coming so rapidly, and the impacts are so deep and profound. So I just would like to run down a couple of data points that we are watching every day, all kinds of things from the economic stimulus, and Mayor, you mentioned that earlier in your comments. This is $2.2 trillion. We want to understand it in our policy and budget department, what impacts there may be for local governments, small and large businesses, and so forth. And we're tracking that. When it's complete and signed off, we'll have some information on that. I would just suggest that you consider that $2.2 trillion stimulus would equate to 10% of the gross domestic product of the country for a year. It's such a large stimulus. It's unprecedented. But we're taking it into consideration with so many other things. Also reported this week was that the country had 3.3 million jobless claims for the week, which was by far a record. The previous record for 1 week occurred in 1982, and it was the largest 1 week set of claims since the country's been tracking that since 1967. Also in Colorado, there were 28,000 jobless claims for the week, and just as a point of reference, the highest weekly filing in Colorado during the Great Recession in 2008 was 7,800. So you can see the magnitude is an order of 3 to 4 in terms of unemployment. One of the things that's unusual about this, and while all of the economics rules will be rewritten, there'll be many PhDs authored on this subject and on this the economic impacts from this virus, were comments made this morning by Fed Chairman Jerome Powell. He spoke on the Today Show, which I think was the first of the program in 50 years, that this is an unusual change in the economy and that it's a gap from our very highly productive, low unemployment economy of just a month ago to some future point in time none of us can predict, when there will be some partial or full recovery. And I felt that his comments were very interesting. So I just wanted to run down some of the data that's out there, and then just kind of talk to you a little bit about what we're using to forecast the impact for the Westminster community. I think everybody's aware that we collect sales tax as our primary source of revenue, and yet that's done in arrears. So all of the retail transactions that are occurring in the Westminster community, or not occurring as the case may be, for the month of March are only paid over to the city once, and that's at the end of April. So we won't have real concrete, hard and fast data for some weeks, but that doesn't mean we're not doing anything, of course. We're having a look at these national forecasts and trends, and we're also extrapolating some of these jobless claims and other statistics across what we learned last decade in Westminster about unemployment and drop in revenue, and also looking very keenly at our sectors. For example, 15% of the sales tax collected to City of Westminster is from the restaurant sector, which obviously we know what's occurring in that particular area. So we're doing some extrapolations to try to better understand the forecasted impacts to the Westminster community. And we also have other things in mind, just some of the business process logistics, like, for example, many businesses and many homeowners will be paying their property tax in April, and that's a seminal moment. So we're trying to understand and collaborate with our partners across the region as to what we might expect in terms of delinquencies or abatements and those kinds of things. So we're doing much in the area of forecasting. And of course, we're collaborating internally every day with our Department of Economic Development and our Finance Department to try to really understand all of these trends and make the best forecast possible. But I wouldn't want to end the discussion there. I want to talk a little bit about some of the tools that we will have at Westminster to deal with this unprecedented situation and how we will respond to these impacts. And first, and I had a note or two to this effect in one of the daily reports to City Council. Of those listening in the public, I want to reiterate it, and that is that the city has a $9 million general fund stabilization reserve and a $14 million general reserve, both of which would be appropriate for use in this time of need. We're glad to have those there, and we will need them, certainly. Obviously, this is a destabilization of revenue that we're anticipating, and clearly it's an emergency. At the same time, we have a few other tools that we're utilizing. I think that it's been reported to council that we have a strategic hiring freeze at the city. And I want to emphasize strategic, because of course we'll be looking to fill all manner of positions that can support the human health impact in the Westminster community. Another thing that you'll be seeing, council, on your agenda in the coming days is that we're working very rapidly to refinance any and all of the city's outstanding debts that we can for lower interest rates and greater savings, which will then, of course, redeploy into services in the community and hopefully maintaining some reserves. And we're going to bring one of those refinancing ordinances to you on an emergency basis. The reason for that is that it will give us the opportunity as a community to refinance more quickly and to do that so that we can ensure that we achieve these savings and not miss this very special window of opportunity. As I'm looking ahead, another tool that we may consider and may recommend is the idea of doing a one-year budget. Frankly, it's going to be very difficult to forecast much further out into the future beyond 2021, and it might make more sense to focus on that more keenly in the months ahead in terms of a one-year budget. So those are some of the many tools that we will be analyzing and looking ahead to. But I just want to close by saying it's clearly this staff of very effective, experienced, and educated people that will contribute to the innovation and to the forecasts and to having the greatest positive impact for the Westminster community. So we have a high degree of internal and external collaboration that we think will contribute to hopefully the best outcome possible, both in the short term and in the long term. So with that, as City Manager Don Tripp just mentioned, I want to say that if we see a need or an opportunity to visit with council about achieving new or revised policy, we will absolutely reach out to you as fast as possible to do that so we can have the greatest help and impact to the Westminster community. So with that, hopefully I addressed that general question about economic impacts, and perhaps Mr. Voles, some of the questions that you had, Councilor, and I'd be available for any questions. Thank you.
Before I go back to the council, if you recall, I sent you a document that we had received as part of a Jefferson County briefing, that the projections from the county, if you recall, they were projecting a $12 million shortfall in the 2020 budget. Hopefully they were going to get that fixed through the election last November on the debrucing, which was rejected by the residents of Jefferson County. So they already had a projected shortfall. In the document I sent to council from the briefing we had 2 days ago, Jefferson County was anticipating that they could see in the state general fund a 30% drop in revenue. That is changing again on a daily basis, depending on how long this shutdown stays in place, how much time businesses are not doing. They are also looking at a delay so that people aren't paying penalties on property tax payments, sales tax payments and stuff to the county. But those issues are still being talked about. They haven't made a final decision that I am aware of. And I don't know if Don, if you've heard anything different from either Adams or Jefferson County on officially delaying those payments.
You know, my conversations regionally have been more along the lines of the virus and collaboration on the public health issues. We really haven't spoken to anybody outside of our borders on financial issues. That'll be a step we'll probably be taking in the next couple of weeks.
Okay, thanks, John. Mr. Voles, you had a comment you'd like to make?
Yeah, thank you, Mr. Mayor. This is John Voles, and I just want to say thank you, Mr. Dorr. That was an excellent response. I had two questions of the four that I asked, and you answered them as best we can at this early kind of uncharted territory we're in. You know, modeling, what kind of estimates do we have? You're on top of that, and then also our cash reserves. How are we doing with our reserves? And you're working on it as well. So I just want to compliment you and thank you for that response. And it covered two of my questions. We will not need to ask this again. Thank you.
Ms. Seitz.
Thank you, Mr. Mayor. I have to agree with Councilor Voles. I was going to strike it from the list of questions because I thought it was a little unfair that you might not have had time to do the level of in-depth thought and analysis that you clearly have. So thank you. And I do have to say it is wonderful to have you on board. We didn't realize how much we would need you prior to this event. So thank you so much.
Going back to Ms. Seitz. Ms. Seitz, have we answered question 3 for you, or do you still need to ask that question?
There was I had amended it in the chat. I was just wondering if there has been thought to increase maybe porta potties or any sanitation stations to help with homeless hygiene. I'm very concerned about that population, in that I don't want them feeling the only place they can go is grocery stores because they're one of the only places open.
Mayor Pro Tem Sites, this is Deputy City Manager Barbara Opie. Staff has actually researched about adding additional wash stations, and there are none available at this time. So we know that at least one of our Westminster churches has secured funds to help get additional sanitizers and other hygiene items to distribute to the homeless population, and staff is working with them to work on those logistics. We also understand that Adams County has purchased other sanitizer and hygiene products and providing those as well, where they're able to. So unfortunately right now, they're not available.
Thank you.
I'm going to move on to Councilor Bowles. He had originally 4. He asked for questions 2 and 3 to be stricken. He's already got his answers. I'll go to question number 1. How is our public safety staff holding up? EMS, fire, police, dispatch. Do we have any of those staff who have tested positive for the virus and are in quarantine? Are they experiencing a significant increase in calls due to the virus yet? And what about overtime? Mr. Tripp?
Deputy Opie, I'll let you go ahead on this, and certainly if you want to bring your chiefs into the answer, feel free to do that. But if you've got the answer, go ahead.
I'll actually let Chief Carlson and Chief Hall please answer.
Thank you. I'd be happy to chime in. This is Tim Carlson, Chief of Police. For how our staff are holding up, I've mentioned to our CMO leaders over the past week. I've been visiting our roll calls consistently over the past week, and I can tell you that our cops are some of the calmest people on the planet. They get it. They understand it's an issue. They have what they need to address it. They don't like it any more than anybody else, but their morale is high. They understand what they need to do. They're doing their job effectively. And that goes for all our staff as well. Our dispatchers are a key component of what we do in service delivery. And we've taken some active steps to ensure that work group is safe where they are and can continue to do their job. As to staff that may be isolated or quarantined from the police department, we do have a few, less than 10 at this point. Most of those have been through potential exposures away from the job and not on the job. So, and our calls for service are about the same, believe it or not. Our overtime expenses are really no different than they were compared to the same time last year. Of course, who knows what can happen over the next few weeks, but that's kind of where we're at. I'm very proud of our people. They're in good spirits. They work hard. They know what they need to do. When they have an issue, they bring it up. We address it. So I'm very pleased with how that's going.
Chief Hall.
Thank you, sir. Doug Hall here, Fire Chief. I would state that the morale of the firefighters, paramedics, and the officers is very high. As everyone knows, they're deeply committed to serving the community. They're well aware of the risk, and they're doing the necessary things to protect themselves and to protect the patients and the community. We have, as of tomorrow, there will be 8 that have self-isolated / quarantined. All of them are, none of them have been diagnosed specifically with the COVID virus. They have symptoms, whether it be flu-like symptoms or they have high temperature, sore throat, respiratory, that type of thing, that are different components of the virus, but they have elected to self-isolate, to take care of themselves at home. We check on them every day, get feedback from them through their officers, and they are all doing well. And we're anticipating as time permits them to recover, they'll be returning to full duty shortly.
Well, thank you for that. And again, this is John Bowles. I just want to say, Chief Hall and Chief Carlson, please express to our team in public safety how much we appreciate. They're on the front lines of this battle against this virus, and we appreciate it. And like Chief Carlson said, we're very proud of them. So please express that whenever you get a chance, and we'll do that as well. So thank you very much.
Will do, sir. Thank you.
Mr. Tripp? Anything to add on this one?
Thank you. I have nothing further to add.
One of the things I'd like to follow up on is one of the things that both chiefs mentioned. In the discussion I had with the hospital this afternoon, here's an example that we're running into, and this is what's driving us all nuts, is the lack of ability to get test results back. If a member of the hospital gets tested, it's taking as much as 14 days to get that test result back. The effective quarantine place starts the day that the results from the test are made. So even if they've been off, their quarantine date for them is starting from the day they get the results. Once they've gone through the quarantine of the 14 days, they have to be retested before they can go back to work to ensure that they're, so then you've got another weight in there. This inability from the state level to get us more testing capability is driving everything nuts because we can't get things turned around in a reasonable amount of time. We talked at the hospitals this afternoon. Deputy Chief Opie and I had a meeting with them on Monday. We are set up to talk to them on a weekly basis about where they're at, asking if there's ability even for the hospitals to start to do own testing. Right now, that testing capability is not there. We're asking them to go to their leadership to see if we can do that, but it still would take approval by CDPHE for them to become testing. We have got to find ways statewide to get more tests processed and test kits here available to the public. And we are working with our hospitals and our first responders to try to find more ways to get that, but we need the capacity and the ability to find material to do testing with, then get them processed. So this is an ongoing thing that we've got to continue to deal with. Going back to Councilor Bowles, I think we've answered your first three. Going on to number 4, the question was, this may be covered in tonight's conference call for North Metro Business, but is there a group meeting regularly? Let me try that again. This may be covered in tonight's conference call from North Metro Business, but is there a group meeting regularly that includes small and large business leaders, nonprofits, and government staffers to gauge what can be done to assist struggling businesses and workers, particularly overworked or unemployed? How can we leverage partnerships? Mr. Tripp, I'll let you and your staff look at that one.
I'm going to ask John to come up, and maybe Larry will be in on this too, but John for sure. I would just say, to the extent that we can make time available, I think we're all hands on deck, trying to stay connected to the business community. I had a presentation with the Westminster Chamber at noon today, supported by some staff that were there. I know John has been, in the front of this with a number of different organizations. So I think we're all trying to do that. But John, could you add maybe a little more definition to what that means?
Yes, Don, thank you. This is John Hall, Economic Development Director. The short answer to your question is yes, and it's part of the challenge. There are multiple groups meeting at multiple levels. So at the state level, the county level, and then at the sub-regional level of all of the players that you've identified in your question. So small and large business leaders, nonprofits, and government staffers working on all of the economic facets of this problem. That's fairly normal for the initial phase of a significant disruption in the economy, that you have lots of groups convening and not a lot of structure to it. That's beginning to sort itself out, so that we are beginning to clearly identify the issues that need to be focused on, and the right people aligned with the right groups over the right period to address each of the issues. So when we started the meeting this evening, I alluded to some of those groups, including the State Office of Economic Development, the Governor's Office, Adams County Business Response Team, the work we're doing locally with our economic development partners in adjacent jurisdictions, and chambers of commerce. Our business leaders are really torn at this point in time, both trying to keep the businesses moving forward while also participating in strategic efforts to deal with the unfolding crisis. So more to come on that. It is sorting itself out, but there's an awful lot going on in group meetings.
Yeah, Mr. Hall, thank you very much. Again, this is John Bowles, and I know you have a lot on your website at the Economic Development Department website on our city website. And thank you for that answer. I'm hearing good things. So, and you're partnering and doing a lot with businesses around our community. So, thank you for your efforts.
Mr. Bowles, did we get through your questions?
We did. Thank you very much, Mayor. Yep, I'm good. Thank you.
All right. All right. Moving on to Councilor Smith. Question number one, the only thing I'd like to add and have clarified are what are essential services and what will or could local businesses be fined for operating? Meaning, can extermination places stay open, public health service? What about auto body shops? Are these essential? I've got an email asking if dog parks are considered a park and will close. I would ask for more clarification. Mr. Frankel, I'm going to ask you to take in on a part of what's clarified. You or Mr. Munch, either one, since you've been doing the legal research on the order. And after that, I'd ask Mr. Tripp to try to answer this piece on the parks.
Glad to, Mr. Mayor. This is Dave Frankel. As far as the state's Department of Public Health and the Environment updated public health order, which was issued this morning, there are over 100 exceptions identified to the stay-at-home order, and among those 100 are critical businesses, and there are entire pages and pages as to what constitutes a critical business. So some of the guidance I think I could provide to you on short order would be the text of the order itself, but also as far as the FAQ, which I understand now we also do have a link to on the City of Westminster's website that Deputy City Manager Opie identified earlier. So as far as whether a local business would constitute a critical business would be very case dependent, and I would refer those with questions to look down the list that has been promulgated by the state. And I also understand that the state's list came out last night and it was amended this morning, and it could, of course, be further updated.
This is Matthew Munch, Assistant City Attorney. Just to tack on a little bit, we do think that auto services are specifically enumerated as an essential business. It's paragraph 5, bullet point 6, mainly for people who are going to be using essential services need to be able to get there somehow. A lot of the other ones we do expect might be modified. I can tell you that dog parks, it is a little bit up in the air at the moment. The question about whether dog parks must or must not remain open was raised earlier today in a conversation with Tri-County Health. They expect to ask the state for clarification on that. So I would expect this list to be modified in the near future and possibly modified more than once. But I can at least answer the auto services question for you.
One of the things I will tell you that was on the Tri-County call this afternoon is also being asked by others right now under Tri-County's definition, tennis courts, even if they're privately owned, are not considered to be under the auspice of a closure. But there's also the issue of an interpretation of if this is in violation of the state order about close proximity. So the Tri-County is asking about that as a part of the clarification that they're going back to the state on, and not only regards to HOA properties being private property, but also public tennis courts and golf courses. Those specific ones are going back through Tri-County. They were on the list that being submitted for clarification today. So, Councilor Smith, I believe we have answered your question 1.
Yes, Mr. Mayor, and Mr. Frankel is correct. Moving fast through all of what was changing from Tri-County and Jefferson County, there was a lot of information, and I missed some of my question was answered in all of those orders. Not specifically the dog parks or the tennis courts or the golf courses, but there were, in fact, when you read through slowly and you're actually able to understand the orders, it did list out several exceptions as far as critical needs. So thank you for clarifying that.
And going back to Mr. Munch, this is Matthew. I know one of the things that we're dealing with is the amount of specific items that were defined in the 2 county orders are not found to be as specific in the state order. But there's clarifications being asked on a lot of those by both Tri-County and Jefferson County. Am I still correct?
That is correct, sir. I know that they are engaging in an ongoing dialogue. There was a long phone conference earlier today where a lot of different cities and counties were able to field questions they wanted clarification on. So I would expect there to be some ongoing changes to this as the questions arise.
If we could go on through Councilor Smith's other question, could we ask, also know if staff has looked at and if City Council would be the ones to approve a tax deferment for our businesses? Mr. Frankel, I think you and Mr. Dorr are planning on handling this one.
Yes, Mr. Mayor. So the question to me suggests it's got a couple of aspects. There's the legal side and there's the policy side to the question. Relative to legal requirements, the Westminster Municipal Code, if council were proposing to amend the municipal code, that would need to occur by an ordinance. There are many legal issues that would need to be reviewed depending upon the scope of the change that is proposed, because our sales tax is voter approved, and we have specific subsets that are public safety and parks and open space specific funding streams that, based on the voters' approval, are sort of designated for specific uses. So that said, though, the code as it currently reads does provide for the ability for our finance director to extend filing deadlines for good cause shown on written requests. So we do have built into the code as it currently is written, the ability to offer for good cause shown extensions of time for making returns and payments of taxes. Similarly, there are flexibility provisions that are built into the code. Also, that's at 417 in our code. At 4121, similarly, penalties can be abated by the finance director on good cause shown. So within that framework, though, is to me, perhaps the more important question of the policy that is the goal of council, if this could be perhaps refined. And I would look to Mr. Dorr because the policy considerations are, I would describe as complex. Larry?
Thank you, Mr. Frankel. In addition, if I may, just for the public understanding of this, as a city, in Westminster, as a home rule city, we are collecting and administering our local sales tax. And for those who aren't operating businesses, you may not have known that, but we are doing that at the local level in Westminster. So one of the considerations related to this is the idea of any blanket or all business deferral or deferment is the idea that it would inure a very large benefit to Fortune 100 global companies that are doing business in Westminster. We wouldn't have the ability under a tax deferment to be discriminatory in nature. So it'd have to be a portion or all of the tax deferred should that be approved through the legal course. as Mr. Frankel talked about here just a minute ago, but think about the very large companies that are doing business in Westminster, like the Walmart Corporation, Kroger, and so forth. And a more strategic approach would be to address need. Additionally, about 30% of the sales tax revenue to Westminster comes to the city from businesses that aren't doing business at all. They don't have locations in Westminster. So companies like the Amazon Corporation, very obviously, that we're all aware of, might benefit from some type of deferral. So a more strategic approach to assisting businesses that may be struggling to pay their sales taxes, as mentioned by Mr. Frankel, is the idea that the finance director has the authority to review requests and waive fees and penalties and so forth in the course of collecting the sales tax. In lieu of that, perhaps a more strategic approach, and I'm going to tee up Mr. John Hall from the city's Economic Development Department to talk a little bit more how a strategic approach to assisting businesses, and I know that he talked a little bit about this earlier, and he might talk about some of the things happening across the country related to a strategic approach to assisting businesses, as opposed to something that is a little bit more blanket and may have some unintended consequences and may be more difficult in time to implement and make impact. So if I may, Mr. Hall, just invite you right off the cuff to make a couple of comments about a strategic approach versus the blanket and need versus otherwise. Thank you.
Thank you, Larry. John Hall, Economic Development Director. I do think a strategic approach is probably warranted here. We have seen a fairly uneven policy response on the part of the counties and the state in identifying which businesses could continue to operate and which ones would have to close. And by uneven, I don't mean to criticize at all. I simply mean they were operating on the basis of the need for social distance. That had an uneven impact on which businesses could continue to operate. So you have seen, for example, Denver take the approach of creating a fund to provide assistance primarily to restaurants and bars as a way of helping them bridge what we hope is not a long-term condition, rather than necessarily a blanket deferral of the payment of taxes, which obviously has an impact on the city's revenue position. So those would be my comments, and keep in mind, please, that there are preliminary comments and we're continuing to work on this problem.
Thank you, Mr. Hall. If I may just kind of close this comment loop up for just a minute, is the idea also that if this is an interest of the City Council, Mr. Frankel and I chatted about this a little bit earlier today, that it would require a review of the various covenants that the city has agreed to in its borrowing arrangements and in its economic development incentive agreements and revenue sharing agreements, intergovernmental agreements, and so forth across the entire community to see if there have been promises made in those various documents that would impact the city. And then also there's this more profound consideration of voter approved sales taxes are to be used for a specific purpose, and would this fall under that purpose? So with that, I think we would answer any additional questions and take any feedback and direction.
Mr. Kirschbaum, would you like to add any other comments to this?
Thank you, Mr. Mayor. If I could just circle back to the previous discussion about essential services for just a moment. There is discussion throughout the state directive in reference to infrastructure. I would just like to assure City Council that our water treatment plants, water distribution, wastewater treatment plant, and our wastewater collection systems are operating at normal levels. And in terms of water quality, we continue to meet the level of service standards that we always meet for the community, and nothing has changed in that regard.
Mr. Tripp, anything you'd like to add?
Not at all.
Going on to Councilor Smith's second question.
Thank you, Mr.
Councilor
Mayor.
Smith, you said you'd like to make a comment. Go ahead.
Yes, Mr. Mayor. My question essentially has already been answered about maybe potentially adding this to our council strategic planning or team building process. We were supposed to go into a team building process this past weekend, and it had to be canceled, obviously because of our current situation. So I look forward to having more discussion on this. And I just wanted to thank our entire community, first responders, our health care professionals, public works, for coming together as a community, and especially with our small businesses right now. But from one staffer to another, I just wanted to thank you for everything you're doing. You can plan, but you certainly can't plan for something like this and this fast. But much to Councilor Seymour and Councilor DeMott's point, we need to make sure that we're being cohesive as a team in what we're doing. And I certainly appreciate this call tonight. There are lessons learned that we can have from this entire situation. And with such a changing and evolving process, I can understand where we're all getting tripped up and how it's confusing for our constituents. But I think it's impactful and meaningful that we come together for meetings such as this special meeting to clarify and help dig deeper for residents and understanding of what we can do as a council and as a city. So like I said, I hope to bring this forward. I have many other questions that we'll go into at a later time, but I really, really appreciate this meeting tonight. So thank you.
So in regards to some comments that we received, one of the things that we're trying to advertise through not only the city's operations center, but the counties as well, is the amount of testing needs that are being done throughout the county. But this is not just a city or county issue. This is a statewide issue on the ability to get testing and get more testing capability, but also the material to do the tests with. So these issues are continually being worked. Our county EOCs are aware of the issue. That's being communicated through our Emergency Operations Center. And then from there, we'll try to keep this going, but right now things are still fluid, as everybody has heard on this call tonight. Things are changing. We expect to see more changes in the state order tomorrow. We will try to keep these meetings right now. My best intention is to try to have another meeting at least on Monday. I know this was supposed to be a night off, but based on some of the information we have waiting to come down through the counties, the state, and our feds over the next couple of days, we may schedule another session like this for Monday. So just stand by and watch for information coming out. Refer to the information being provided by Ms. Opie and others that comes out on a daily basis. We encourage our residents to refer to the website. That's updated as much as they can as soon as they get information. There's just a lot of stuff that's moving that we don't have firm targets on, and we want to make sure that what we put out is good, accurate information. So again, appreciate the staff staying on tonight. Council, thank you very much for your time tonight. If there are any questions that have not been answered, if the council can let me know you have a question through the process we've been using tonight, then I'll turn to you. Go ahead, Ms. Smith.
I'm sorry, Mr. Mayor, I was responding to Councilor Scully's comment.
Mr. Mayor, this is Catherine.
Yes, ma'am.
I put in the chat that I would encourage us to have more meetings like this more frequently. while we are going through COVID-19, just to make sure that we're working together as a team, helping us to stay up to date on the information, and also to help our residents hear what we are hearing and what we know. I think we're all getting a lot of emails and a lot of questions, and we're doing our best to answer them, but it helps when we come together as a team and can talk together as a team facing the residents and let them know that we are working this very hard, just like they want us to. So I would move for more meetings like this, maybe another one in a week, or maybe we plan to meet on Monday. I don't know, but I think we need to have some more of these.
Yeah, right now, Council Scully, my intent is to at least have one this coming Monday, because we are waiting on a number of orders to be changed and some updates from not only the state but the Fed, and we're waiting for that information to come in. Now, if we do not get it, we will hold these meetings as soon as we have something to add. But just to have a meeting, I think we're all busy enough, but we will try to keep the information flowing as fast as we can. But right now, I'm advertising to the council, you should anticipate that we will have another meeting similar to this, at least on Monday.
Thank you,
Are there
Mr.
any
Mayor.
other questions from the, are there any other questions from the council at this time? Mr. Demott?
I just want to take a second to thank staff, because I know you're busy, and thank you again for putting this together. And Mr. Mayor, I think it was very valuable and important that we did this, and everybody stay safe.
Thank you, sir. Mr. Tripp, would you like to try to wrap up?
The only thing that I have to say is that I am absolutely humbled by the people who put this meeting together and the staff that responded to your questions. You have quite a city. You have quite a city. Thank you, Michelle and Cody, for what you did to make these things happen. Ryan, in the background, and what you've done with communications is remarkable. And all the departments, you know, from I'm not going to name all of them. Our deputies and our department directors are absolutely extraordinary. And I'll tell you, not a single one of those people has had a day off for quite a while. So thank you, folks, very much. And council, we always appreciate your support. We always appreciate your support. We've got these people and they've got the resources. Tim talked about the resources in PD. Those things happened over the last 3 years. And you know, those are tough things to do. And you've been there to support us when we needed things. So it helps us today. So thank you. That's all I have.
Thank you, sir. Well, for the benefit of everybody, it's approximately 8:28. This meeting is now adjourned.
Thank you.
Thank you, Mr. Mayor.